Breast cancer is a type of cancer that forms in the cells of the breast. Breast cancer occurs when normal breast cells start to grow and divide uncontrollably, forming a tumor or mass of abnormal cells. Over time, these cancerous cells can invade nearby tissues and spread to other parts of the body through the lymphatic system or bloodstream. Breast cancer can affect both women and men, although it is much more common in women. It is the most common cancer in women worldwide and the second most common cancer overall. Early detection and treatment of breast cancer can increase the chances of successful treatment and survival. The exact causes of breast cancer are not fully understood, but there are several factors that may increase a person's risk of developing this disease. These factors include 1. Genetics. Inherited mutations in certain genes, such as BRCA1 and BRCA2, can increase the risk of breast cancer. 2. Age. The risk of breast cancer increases as a person gets older. 3. Gender. Breast cancer is much more common in women than in men. 4. Family history. Having a first-degree relative, parent, sibling, or child with breast cancer can increase a person's risk. 5. Personal history. Having a history of breast cancer, certain benign breast conditions, or previous radiation therapy to the chest area can increase the risk of developing breast cancer. 6. Hormones. Prolonged exposure to estrogen and progesterone, such as early onset of menstruation or late onset of menopause, can increase the risk of breast cancer. 7. Lifestyle factors. Certain lifestyle factors, such as a lack of physical activity, being overweight or obese, alcohol consumption, and smoking, can also increase the risk of breast cancer. Other possible risk factors for breast cancer include 1. Dense breast tissue. Women with denser breast tissue may have a higher risk of breast cancer. 2. Radiation exposure. Radiation exposure, particularly to the chest area, increases the risk of breast cancer. 3. Certain medical conditions. Certain medical conditions, such as atypical hyperplasia or lobular carcinoma in situ, LCIS, can increase the risk of breast cancer. 4. Certain medications. Some medications, such as hormone replacement therapy, HRT, and some types of oral contraceptives, may increase the risk of breast cancer. 5. Environmental factors. Exposure to certain chemicals, such as those found in some plastics and pesticides, may increase the risk of breast cancer. Many of these risk factors are modifiable. Additionally, many cases of breast cancer have no known cause, highlighting the importance of regular breast cancer screenings and self-examinations for early detection and treatment. Breast cancer symptoms can vary from person to person, and some individuals with breast cancer may not have any symptoms at all. However, here are some details about the common symptoms of breast cancer. 1. A lump or thickening in the breast or under the arm. The most common symptom of breast cancer is the presence of a lump or mass in the breast tissue or under the arm. The lump may feel hard or soft, and it may be painless or tender to the touch. 2. Swelling, redness, or warmth in the breast. Breast cancer may cause the breast tissue to become swollen, red, or warm to the touch. These symptoms may be accompanied by pain or tenderness in the breast. 3. Changes in the size or shape of the breast. Breast cancer may cause the affected breast to appear larger or smaller than the other breast, or it may cause the breast to change shape or become asymmetrical. 4. Dimpling or puckering of the skin on the breast. Breast cancer may cause the skin on the breast to become dimpled or puckered, resembling the skin of an orange. 5. Nipple changes. Breast cancer may cause changes to the nipple, such as inversion, turning inward, discharge, or scaling. The nipple may also become itchy or develop a rash. 6. Pain in the breast or nipple area. Breast cancer may cause pain or discomfort in the breast tissue or nipple area. This pain may be persistent or intermittent and may worsen over time. It's important to note that these symptoms can also be caused by other conditions, such as infections or benign, non-cancerous breast conditions. The diagnosis of breast cancer typically involves several steps, which may include 1. Breast exam. Your healthcare provider will perform a physical examination of your breasts to check for lumps, changes in size or shape, or other abnormalities. 2. Imaging tests. Imaging tests, such as mammography, ultrasound, or MRI, may be used to examine the breast tissue and detect any abnormalities or areas of concern. 3. Biopsy. A biopsy involves taking a sample of breast tissue to examine under a microscope for the presence of cancer cells. A biopsy can be done in several ways, including fine needle aspiration, core needle biopsy, or surgical biopsy. 4. Pathology testing. If cancer is detected through a biopsy, the tissue sample will be sent to a pathology laboratory for further testing to determine the type and stage of the cancer. 5. Staging. Once breast cancer is diagnosed, further tests may be done to determine the stage of the cancer, which helps determine the best course of treatment. Tests used for staging may include additional imaging tests, such as PET scans or bone scans. Early detection and diagnosis of breast cancer can significantly improve outcomes and survival rates. It's recommended that women receive regular breast cancer screenings, such as mammography or clinical breast exams, starting at age 40 or earlier if there is a family history of breast cancer or other risk factors. While there is no guaranteed way to prevent breast cancer, there are several steps women can take to help reduce their risk of developing the disease. Here are some tips for breast cancer prevention. 1. Maintain a healthy weight. Being overweight or obese increases the risk of breast cancer, particularly after menopause. Maintaining a healthy weight through diet and exercise can help reduce the risk. 2. Exercise regularly. Regular physical activity can help reduce the risk of breast cancer. Aim for at least 30 minutes of moderate exercise most days of the week. 3. Limit alcohol consumption. Drinking alcohol increases the risk of breast cancer. Women should limit their alcohol consumption to no more than 1 drink per day. 4. Don't smoke. Smoking is associated with an increased risk of breast cancer, particularly in younger women. Quitting smoking can help reduce the risk. 5. Breastfeed. Breastfeeding may help reduce the risk of breast cancer, particularly in women who breastfeed for longer periods of time. 6. Get regular breast cancer screenings. Regular breast cancer screenings, such as mammography or clinical breast exams, can help detect breast cancer in its early stages when it is most treatable. 7. Know your family history. Women with a family history of breast cancer may be at increased risk and should speak with their healthcare provider about appropriate screening and prevention strategies. However, if you notice any changes in your breast or have concerns about breast cancer, it's important to consult with your healthcare provider for further evaluation and testing.